Hey there, welcome to my PhysioYoga channel. Today I'm going to go through legs up the wall pose with something that you can do with your lower extremities. And this position that I'm going to take you through today, we're going to elevate the pelvis so that your pelvis, your hips are higher than the level of your heart, and of course your legs are higher than the level of your heart. So this position or this pose would be good for any reason why you would want to elevate. I'm not going to go into that now, but some of the indications may be for increasing circulation or lymphatic drainage, maybe for lower extremity varicose veins or pelvic varicose veins, like in pelvic congestion syndrome. And so what we want to do is have your hips a little bit higher than your heart. And this blanket fold here, we learned in our medical therapeutic yoga training with Dr. Ginger Garner, and it's a yoga couch or a 3-tiered system. So check the link below on how to fold 2 blankets in this structure. So basically you're just taking 2 blankets, and then the top one you make this little pillow, and often we lie on it this way with our head here, and that supports the cervical spine, the lumbar spine. But today I'm going to, we're going to flip it so that our hips are on here. So to get on this yoga couch, you have to kind of come on the side, and you have to go uphill. So if it's the first time you're doing this, sometimes it's a little bit awkward, but you get it after a while. And then once you get yourself settled, you can feel your sacrum on the pillow part of the couch. And then the rest of the blankets, it's a nice cascade, like a waterfall down, supporting through. And if you feel like you need something for your head, if it's really tipping back, you could always just put a little blanket fold underneath your head. But you can see my pelvis and my hips are just a little bit higher than my heart. And I'm a little bit away from the wall now. You could bring your bottoms right up to the wall if that's okay on your legs. This is a little bit more comfortable for me. And then the first thing that you can do is just nothing. Just relax and notice your belly breath or your abdominal diaphragmatic breath. Just allow the belly to rise when you inhale and fall when you exhale. And then you can even visualize your pelvic diaphragmatic breath or the movement of the pelvic floor when you're breathing. So when you inhale, the pelvic floor descends downwards and widens. So the belly's rising as the respiratory diaphragm goes down, the pelvic floor goes down, and then when you exhale, the pelvic floor goes back up and into its dome-shaped position. You just feel that nice flow. And after you've rested there for maybe about a minute, you can start to do some toe ins and outs with the lower extremities. So just have a look at your feet and bring your big toes so that they're touching and that your hips are internally rotated. And you can even bring your hands to your sit bones here and feel where the sit bones are, and even come to the inside of the sit bones, and you can feel deep into there, maybe some tenderness or trigger points. And then just open up the legs or the toes. So now you're in external rotation of the hip, just going as far as you feel comfortable. And then bringing the toes back together. And so what we're going to do here is we're going to time this with the breath and actually visualizing what's happening with the pelvic floor. So we're going to first just release all your breath out. And then inhale and toes touch each other as the pelvic diaphragm goes down, and feel like your sit bones widen at the back. And then when you exhale, open up, toes go apart, sit bones come closer together, the pelvic floor goes up and in, kind of like zipping up and in. So inhale, toes together. Pelvic floor goes down, expands and widens. Exhale, toes open, pelvic floor goes up and in. Inhale, toes together, diaphragms down. Exhale, back up and in. So hopefully you can feel that rhythm and get a sense of the sit bones widening on the inhale. And then just relax. And we're going to switch the breath on you. So now what we're going to do is we're going to inhale as the legs go out and exhale as the toes come together. So let's go all breath out, just fully exhale. Inhale, toes out. Pelvic floor expands and goes down. Maybe feel opening more in the front part of the pelvic floor. Exhale, toes come together and press them together gently. So you can feel the inner thighs engaging as the pelvic floor goes up and in. Inhale, toes go out, pelvic floor goes down. Exhale, pelvic floor up and in, toes press gently, engaging the adductors or the inner thighs. Let's do a few more. Inhale, release, pelvic floor goes down, abdominal rises. Exhale, zipping up and in, pelvic floor up and in, toes press. Inhale, open. Exhale, press toes together. And then just relax, and you could just rest here and do nothing. One of your favorite meditations you could do. Other things you could do here, maybe try your 4-part breath, or some of the other things that you can do for circulation and lymphatic drainage. Maybe pumping the ankles up and down, in and out. Engaging the quadriceps and releasing, pumping that a few times, digging the heels into the wall and releasing, so now you're engaging hamstrings. You can do that a few times. And then you can even squeeze your glutes, your buttocks together and relax. Squeeze and relax. All right, and then to come out, careful, just try not to plunk down because you are high up a little bit, so just lower yourself down and help yourself up. So again, whenever it's indicated for you to be in a supported inverted position, this might be a nice option. Just check and make sure that, that you're okay to be inverted and to have your head lower than your heart, because there are some cases where you may not want that pressure in the eyes or in the head. Okay, I hope this helps in some way. Please share with anyone you think that may benefit, and make sure you check out my videos. I have a bunch of videos on YouTube and then also on Vimeo that actually go through relaxation of the pelvic floor and facilitating the proper full movement and excursion of the pelvic floor with breath and with other movements. So, okay, till next time, namaste.